Hello and welcome to 18 WJTS in.form. Via Zoom, we are doing a in.form program with Lesa Seng. She is the TRICAT Resource Navigator, and we're going to be talking with Nikki Lasher. Nikki is a newly appointed position for her as the Director of Health and Family and Community Partnership. Ladies, welcome to the show. Well, we want to talk about, you guys really are, and we've done a show before about your health navigators, which means you help people get on the health marketplace to get health insurance. And typically that window ends sometime in December. But that window is open again until May for people to apply for health insurance. Because I guess there's a new law, or because of COVID, what has happened that we are now have a window open for people to, an open window for people to navigate their health insurance?
The Biden administration just recently opened up this, it's called the COVID-19 open enrollment. And it's because so many people have lost their jobs because of the virus, or their hours have been cut, and just so many impacted one way or the other. So there is this window here of opportunity to enroll again, starting now until the 15th of May. Here, that was just recently added, as I said.
Okay, because typically you can only apply up in a certain window, or if you have a qualifying event for getting health insurance. And can one of you talk about what is a qualifying event so people kind of have an idea? I mean, this new window is different, but what would normally be one of a qualifying events?
Have to provide proof of loss of a job where you're losing coverage, a divorce, life-changing event is the easiest way I can put it, really. And with that, you do have to prove these things. The marketplace will ask for documentation. Right now, during this COVID open enrollment, you do not have to have all this documentation proof. So they're trying to make it as easy as possible for people that are in need right now.
Okay, and Nikki, I think I'm going to direct this question to you. You guys you have other jobs at TRICAT, but you're health navigator. What is a health navigator?
It's just someone that helps navigate through the health, like the healthcare plans for you. So it can be very difficult, or I don't completely understand it. So this navigator is the person that you go to help answer any questions and kind of navigate through the system to help get signed up as easily as possible.
And is there a charge through TRICAT to go to a health navigator, which would be one of you ladies, to get some help finding health insurance?
No, it is completely free.
Okay, so this is a great service that you're offering. Now, in the past, I guess people came and sat, face to face with you and went over their health navigation, but times are different with COVID. So you're doing most of this by the phone?
Yes.
How does that work?
Actually, for months now, yes, I have done my appointments by telephone, and it's worked beautifully. No problems at all. Our clients can still bring documents, any documentation that it's asked for. We have a call button at the front. They can leave their documents. They will definitely either be put straight to my mailbox, or I come up to the front and still handle all the documentation needs. And to do the actual application over the phone has just gone without any problems whatsoever. If for some reason someone would absolutely request to be seen right now, we would not turn anyone down. We would socially distance wise make it work, but I've had extreme luck and no problems at all with doing the appointments by phone.
Okay, because typically people would be doing this on their computer at home by themselves, navigating, so to speak, through the health marketplace and trying to choose a plan that's right for them and entering information. But you make it easier for them because you're doing that kind of for them on the phone.
That's right. I mean, everything that I can do in person, I absolutely do over the phone. We go over the plans. I go over clients. They give me, if they're on their medication list, that I can make sure that they're in network with facilities, doctors. We cover it all.
Okay, so I guess it all starts really with a phone call. So I would call one of you, either Lesa or Nikki, and I would say, okay, I don't know what I'm doing yet, but I'm going to need some health insurance. What's my first step? And is that the best way to do it? Just to give you a call and kind of get yourself started? Do I have to have everything in front of me at that time? That's another question. Do I have to have all my information right away?
Absolutely not. But the first phone call, I usually tell the client what is needed to determine what they may very well qualify for. And, all basic household information as far as dependents in the home, how many household members there are. No, the first time we go over, those points, and then on the follow-up application call, they're usually prepared with the information that I will need. I do want to say we have one other navigator. She is in Pike County 3 days a week and Du Bois County 2 days a week. And her name is Judy Richardson. So she also can be, she couldn't be on this meeting today, but she also can be contacted.
And what's the best way to contact? Just a simple phone call to what number?
Yes, and that you would call the Pike County TRICAP office, and that number is 812-354-8721, and ask for Judy Richardson.
Okay, and in Du Bois County, they would call?
Here, the number is 812-482-2233, and my extension is 145.
Okay, now I know in the past it seemed like when the health marketplace started, there were multiple plans and multiple companies you could choose from. Then it kind of changed depending on your county. There may have been only one carrier that you could choose from. What's the situation like today?
The situation today is Memorial Hospital here in Du Bois County is contracted in the marketplace with two managed care entities, and that would be AM Better and Care Source. And then, of course, we have people that, do their doctoring, use Evansville hospitals or whatever. We do have access to check and make sure that any plan that they would pick, that their facility or their providers would be in network.
Okay, so I guess maybe then the question could be for either one of you. So if I call and I say, I go to such and such a hospital, Memorial Hospital, and my doctor is so-and-so, would it be covered one of these two plans? Can you tell me that? Is that something you help me find out?
Yes, it is. Generally, the website, they try to keep updated as best they can with the providers that are accepting. But honestly, I usually tell the client, or if they're here, do it myself, to let's call the doctor's office. Let's not assume anything. Let's make sure.
Okay. Now, I know in the past that it has been set up on a like a Olympic medal sort of a thing. There was a gold plan, a silver plan, a bronze plan, maybe even a copper plan. Is that still the case?
It is still the case. It's bronze, silver, and gold. Your bronze plans have the lower monthly payments, but they have definitely the higher deductibles. Your obviously your silver's in the middle, and your gold has the higher monthly premium, but definitely much lower deductibles. Now, there's something called cost sharing, and it's totally determined by income. If you qualify for cost sharing, you generally would definitely want to take the silver category, because what that amounts to is you get much more bang for your buck. You would get a gold plan, essentially what would be a gold plan for the price of a silver. It is a better deal if you income qualify for the silver category.
And these are things that you will help me to determine, because I guess you're looking at I'm assuming a lot of the calls may come from people who don't have internet access or don't feel comfortable being on the internet. So you're looking at a screen and telling them what you're seeing, and you're helping them to make a decision.
That's exactly
Is the decision mine to make?
The decision is definitely yours to make. I just, guide the process, let them know what their options are. Each person is different. And, it depends on if you take a lot of medication, if you doctor a lot, you're going to need a more plan, that covers much more. I mean, it solely depends on your needs. So each person truly is different. Not only each household, but each person in the household, whatever their specific needs are.
And that's really the beauty of calling TRICAP and having one of you ladies or Judy in Pike County help navigate me through this, because it can be confusing, but you understand it and it makes it a little easier.
Yes, we have received quite a bit of training. I've been doing this for a while, and as we said, this is there's no fee for our services. It's truly what's best for our client or customer, to meet their needs. I'm a healthcare navigator, not a salesperson. So, we do try to find out what is the best fit for each individual.
And we want people to understand, you're not getting a commission. You're not being paid by these insurance companies that offer this. This is something you are doing through TRICAP that is a free service to those that need it.
That's exactly right.
Is it based on income?
Yes.
I mean, I know the plans are based on income, but if somebody just is without insurance, but they have a high income, can they still call TRICAP to have help?
They can still, absolutely, they can still call. Yes.
It's just that I may not get the subsidy that
they may not get the subsidy, but anyone can call us and we will work with them. They may not get the subsidy, but we'll still go through the plans with them and still offer them service.
Okay, maybe if one of you could explain the subsidy part of it, so that people understand that the policy may cost, I'm going to make the number up, $500 a month, but because you don't have the certain income or something, the government may be paying $250 of that or $200 of that. Is that correct?
That's correct. It's an advanced tax credit, and depending on, actually there are a couple of factors depending on your household income. And it is household income. Maybe only, say you have a married couple and one of them may already be on Medicare and just the spouse needs. But it is household income is what is counted. Age comes into play, even location, different counties in the state, it can be different, the prices and whatnot. So that is how the marketplace determines your subsidies or your advanced premium tax credits.
Okay, so is there anything else that you ladies would like to add?
I will just throw in that, like I said, we've been talking about the marketplace, and then also we do Medicaid, all the Medicaid categories, and that's done all year long. There is no open enrollment for Medicaid, which is solely income based and includes the Healthy Indiana Plan, Hoosier Healthwise, traditional Medicaid. We also offer that.
Okay, and Nikki, this question is for you. This health navigation we're talking about is one of just many things that TRICAP does. As you're finding out now in your new position, it's amazing the opportunities and the help that TRICAP offers to people at no charge.
Absolutely. We have programs for obviously the healthcare. We have weatherization programs. We have programs that help with energy assistance, Head Start, the family planning, healthy families. I'm trying to go through all the ones that I'm over. So,
and you know what? And I'm sure we're missing something, because there really, the thing is, I think basically, if you're needing some help or you're wanting some help or you're wanting some guidance, call TRICAP. And if it's not something you provide, you get us going in the right direction.
Absolutely. If we don't provide it, we will tell you who does. and help you find someone to get whatever service that you need.
Okay, and again, the phone number, and do you know what the website is for TRICAP?
For TRICAP,
Yes.
Okay, go ahead, Lesa.
www.tricap. Is it?
App.net.
I think it is.
Yes.
I think, well, you know what? Hey, probably the easiest thing is Google it.
Sure.
Or I'm the kind of person that likes to talk to somebody in person, so they can just simply give you a call.
All I've got in my head is marketplace sites and stuff. Sorry.
That's all right. It's no problem to Google it. They can find the website that way, or Peter may be able to put it up on the screen here for us. But what's the phone number again?
812-482-2233. That's in Du Bois County.
Okay.
And then Pike County, I can give you Pike County again, 812-354-8721.
And really, you're much more than just Du Bois and Pike County. You're multiple counties.
Yes. Yes. We've
So
helped people from all around the area. Yes.
I think the thing is, give TRICAP a call to find out how what the help is that you guys offer.
That's right.
Want to thank both of you for being our guests. Our guests have been Lesa Seng. She is the TRICAP resource navigator. Used to be a health navigator, and your title changed a little bit. We also want to thank Nikki Lasher, who is TRICAP's Director of Health, Family, and Community Partnership. Ladies, thank you for being our guests on WJTS in.form. Stay healthy and have a great day.
Thank you.
All right. Thank you very much for watching 18 WJTS. We are local people watching local people.